Chicago has long been known as the second city, but when it comes to innovation, research, finance, and technology, the Midwestern city plays second to none. It's why at least 36 Fortune 500 companies call Chicago home, including Boeing, McDonald's, and Walgreens. It is here where APS Ketamine is making a name for itself, thanks to cutting-edge treatment for those who suffer from depression, anxiety, PTSD, bipolar disorder, and related mental health conditions. The secret to the practice's success is rooted in the philosophy of its founder, Dr. Abid Nazir, whose aim is to help each patient find hope when hope seems lost.
I've always known I wanted to be a psychiatrist. I kind of made that decision back in maybe 9th or 10th grade, when many of my friends used to say, "You're a really good listener." And I thought, maybe a good career would be to go into psychiatry. And then the more I looked into psychiatry, the more I fell in love with it. So it was always been my lifelong goal. My approach to treating patients is simple. They need to be a partner in the treatment plan. So the first step is that they have to be extremely educated on all the risks and all the benefits. They need to know what to expect. They need to know even some of the science behind what I'm doing and why I'm doing it. Also, there has to be a lot of support. So our staff here knows every patient, every patient's family members. We check in on them regularly. When they come to the office, they have to feel extremely welcome and comfortable here.
Dr. Nazir and his team understand that the best outcomes occur when there is an open, transparent dialogue between the provider and patient. APS Ketamine Care builds upon this foundation by taking a team approach, so their goals are the same as those they serve.
I feel we have a really important role in the community, being the first psychiatric ketamine infusion clinic in the state, in the city. It's a responsibility on us to educate. We're looking to put on events for the public where it would be open to all, where we would speak about ketamine and how it's used in clinical practice, so patients and families can become knowledgeable on it and understand it. It's our responsibility to really educate even other providers who have not started using this medication in their practice, to help them as well to grow, so we can make this kind of life-saving treatment available to as many people as we can in a safe and responsible manner.
With experience treating veterans suffering from PTSD at the Overton Brooks VA Medical Center in Louisiana, Dr. Nazir has worked on some of the most complex psychiatric cases. Today, Dr. Nazir knows that old, traditional methods are no longer effective to meeting patients' modern needs. Advancements in the field of psychiatry are allowing specialists like Dr. Nazir to close that gap so he can better treat complex cases and best meet modern needs. For Dr. Nazir, these days, that means embracing ketamine infusion therapy.
I've been researching new methods of treating depression for a long time. There was frustration and, a lack of response from traditional methods. Ketamine was first synthesized back in the 1960s, actually as an anesthetic. It's a really safely used anesthetic. It does not lower your breathing rates like other anesthetic agents do. It's been used effectively in anesthesia, but it's also been commonly abused in the streets as a drug called Special K. It has had many uses over the years, but we've determined that it can be very beneficial at very low dosages to help depression and anxiety.
Each patient that comes through the door may have different issues that are going on. So what we do is we are going to create an individualized plan for each person. They may be on different medications, they may have different situations going on in their life. So we want to make sure that everybody has the tools that they need to maximize the treatments of ketamine and to make sure that they have a support system when they leave the program.
Across the country, ketamine is being used as a viable, effective therapy that has resulted in positive outcomes for those with severe or chronic depression, PTSD, bipolar disorder, anxiety, obsessive-compulsive disorder, and postpartum depression. As ketamine infusion therapy is growing in popularity, one practice, APS Ketamine, is distinguishing itself in America as a specialist in the field. And that is benefiting people who suffered from depression and considered suicide.
Amy was diagnosed 20 years ago with underlying clinical depression, and that started a long struggle of different medications, experimental treatments, different doctors. I have great hope now, and I think we found the right place too. the right doctor, right team. I'm very, very pleased.
The treatment itself with the staff, with the doctor, and everything else, and what it does for you in such a short amount of time, and how it can bring you back to where you were. That's like miraculous to me. They have undoubtedly helped me find Amy again. And I didn't know who Amy was for a long time.
When you hear from a family member that I have my daughter or son back, and you hear from a patient that I have my life back, that is the most rewarding thing a provider can hear. It's why we do what we do.
Here in metropolitan Chicago, Dr. Nazir and his dedicated staff of psychiatric professionals are using new approaches because they know it works. By doing so, they are changing lives. In both their Oak Brook and Michigan Avenue locations, they are finding hope together with those they serve. Dr. Nazir is also the Chief Medical Officer for Symmetria Health, a national organization whose mission is to fight the opioid addiction epidemic.